EDHEAD presents pneumothorax management. Needle thoracentesis. Indication: an acute respiratory collapse due to pneumothorax. Perform hand hygiene and don gloves, and sterile only if immediately available. Clean the appropriate site of the chest with the Alco-Tip skin prep wipe solution and allow the area to dry. Connect the 10 ml syringe to a 21 gauge butterfly needle or a 24 gauge cannula via the 3-way tap. Insert the butterfly needle into the second intercostal space in the mid-clavicular line, thereby avoiding the nipple. Advance the needle until air is aspirated. Stabilize the needle with one hand and use the other hand to manipulate the syringe and the 3-way tap. Aspirate the air into the syringe, and when the syringe is full, expel the air into the atmosphere via the tap. Ensure the 3-way tap is in the correct configuration to avoid injecting air back into the pleural space. Repeat aspirations if air reaccumulates or until an intercostal catheter has been inserted. Equipment required: 1 ml syringe to administer lidocaine, 0.3 ml per kilo. Chloroprep solution to clean the insertion site, 50 to 60 ml syringe for aspiration. Pre-marked insertion needle at 1 to 1.5 centimeters. The guide wire, which will be threaded through the needle into the chest in preparation for the dilator. The dilator will be used to dilate the skin site. Use appropriate size pigtail catheter for the infant's weight. Spigot is used to connect the catheter to the drain. Steri strips and tegaderm are used to secure the catheter in place. Insertion of pigtail chest drain. Position the infant with the affected side uppermost and the arm extended above the head. Monitor the infant's heart rate and oxygen saturation levels throughout the procedure. Prepare the area with the antiseptic solution and drape. Infiltrate local anesthetic in the mid-axillary line and allow to work. Connect the needle, which has been pre-marked, to a syringe with a small amount of sterile water to enable the air bubbles to be seen whilst aspirating. Advance the needle through the infiltrated skin, gently aspirating until air is obtained. Continue to aspirate if the pneumothorax is under tension. Remove the syringe, occlude temporarily, then thread the guide wire through the hub of the insertion needle via the white plastic tip. Advance until the silver guideline on the wire reaches the white plastic tip. Remove the white plastic tip prior to removing the needle while not allowing the wire to move. Remove the needle, ensuring the guide wire is held in place at the skin. Thread the dilator over the guide wire and insert about 1 centimeter through the skin, then withdraw and remove the dilator. At all times the wire must be held still, not advanced or withdrawn. Feed the pigtail catheter over the guide wire with the holes facing up. Advance to the first or second black line for a premature infant, 4th to 5th for a term infant. Then carefully remove the guide wire. Connect the catheter to the connection tubing via the spigot. Secure the pigtail with a steri strip and tegaderm. Obtain an AP and lateral chest X-ray to check the position and resolution of pneumothorax.